Hello, everybody, and welcome to this Ask the Vet webinar with Dr. Greer, another live event with Revival's Director of Veterinary Services. My name is Shelley. I am the content manager at Revival. Let's get going. So our first question comes from Daffy Dogs, wondering, my male dogs have reduced semen count. What do I use to boost their fertility?
Oh, reduced semen counts. Well, first, I would like to know a little bit more about the dogs, and I doubt if she included that information. So a lot of it's going to depend on the breed of the dog and the age of the dog. Once we see dogs over the age of 5, we do see a decline in fertility because of aging, because of testosterone changes in the testicles, because of prostate disease. So I'd want to know first what their age was, and I'd also want to know second what their nutritional intake is. So what kind of dog food do you feed? I think there's a lot more to nutrition and fertility in the male and the female dog than we really recognize. So if you're feeding a Purina or a Royal Canin product, that's where I would be recommending and where I'd be putting my money is on one of those two products. We know that those products do help us with good fertility, and it's difficult to read the package of a label of a dog food and really understand the micronutrients. The macronutrients are easy, the fat, the protein, and the carbohydrates, those are easy. Those are numbers you can really understand. Like 30-20 means 30% protein, 20% fat. I mean, those are easy things to remember and to understand, but the micronutrients, meaning the things like zinc and salt and magnesium and some of the really tiny little bits of things, they're not well reflected in the nutritional profiles that are listed on the bag of food. So I would be very careful with food. If I were feeding a raw meat diet or an off-brand, a brand that you haven't had good fertility with or you don't have a background on, I'd be switching to Royal Canin or Purina. So once we get those two things taken care of, the age, the prostate health being part of age, and the nutrients, then I would start looking at some of the nutritional supplements that we have. At Revival, we have Oxy Stud, which is going to help bring up his sperm count. We also have the in-between for him that, again, is going to help with semen quality, and it's also going to help with overall health. So I think that I would be looking at those supplements. I also use the ICSB CF+. So that's, again, another product that's meant to help with male fertility. So I think there's some nice products out there, but I would really look hard at nutrition. And then, of course, housing, environment. Is the dog under a lot of stress? Dogs that are traveling on the road for dog shows or dogs that are in stressful kennel situations, those will tend to have lower sperm counts. And you want to be really careful with the kind of disinfectants and other products that the dog is coming in contact with, like their scrotum. If they're sitting on the concrete and you haven't adequately rinsed the disinfectant off, we can see chemical burns on the skin of the scrotum, and that of course causes inflammation, and inflammation is not healthy for more sperm production. So there's a lot of things I'd be looking at environmentally and nutritionally before I would start jumping to some nutritional product to start putting down the dog. But we do have really good quality products that will be helpful to you looking at those products on the Revival website.
Okay, our next question, Dr. Greer, what are your thoughts on supplementing pregnant moms? This person says, I've heard not to give anything extra. What are your thoughts there?
Again, it gets back to what you're feeding. You can't make a crummy diet great by adding nutritional supplements, but you can certainly enhance those diets. Again, I don't want to sound like a broken record, but I really do like the Purina and the Royal Canin diets. I personally feed Royal Canin. I buy every bag of dog food that I feed. I don't get perks. I don't get kickbacks. I don't get paid by the pet food companies to feed their food. I feed a dozen dogs. I currently have 12 little puppies in my whelping box, and I feed a dozen adult dogs. So I'm buying dog food just like you are. So I can come at this from a really honest perspective. I would not feed anything other than those two diets to my breeding dogs. As far as nutritional supplements, I think most of the time we don't need to add anything. If you do have brachycephalic breeds, the bulldogs, the Frenchies, those kinds of dogs, I think adding folic acid can be helpful in reducing the risk of cleft palates. And I think DHA is a nice nutritional supplement because we know that improves the development of the eyes and the brain, especially on bitches that have had more than one litter. We know that their DHA levels are depleted. There was a study done at Canine Companions for Independence, which is a service dog organization out in California. They've been in this service dog business for about 35 years. And they did a study on 5,900 puppies. So it's not a small study. And what they looked at was their graduation rate. So the bitches with their first litter had a graduation rate of 50% of their puppies. And by the time these girls got to their fifth litter, they were down to a 25% graduation rate. So they started dissecting that apart and determined that it was a DHA issue. So by adding DHA, which you can buy online, you can buy it from Revival, you can buy it lots of places. We know that we're going to improve brain and eye development. We know it's not detrimental to their joint and bone development from other studies that were done and published in the AVMA journal. So it's a great product to add. Calcium should not be supplemented until the bitch goes into labor, and then the calcium gels are useful during labor to improve uterine contractility. But you want to be really careful that you're not over supplementing calcium earlier in that. And then most everything else you don't really need to supplement if you're feeding an appropriate all stage or pregnancy diet. The only pregnancy diet on the market is Royal Canin's HT42D. You can only buy it from their website. You cannot buy it at retail, but it's a great product, and it does have the micronutrients in it that are necessary for good development of the follicles so that the eggs are being produced. It helps with placental development. It helps with fetal development. It's a really nice product. So if you're struggling with fertility, I would start on the HT42D diet. It's a terrible name for a dog food, but HT stands for you feed it from the start of the heat cycle, and 42D means you feed it till the 42nd day of pregnancy. And on day 43, then you switch over to the mom and baby dog or a puppy diet so that the bitch gets adequate nutrition. So I hope that kind of helps give you some direction, because I think a lot of times we're over supplementing, but folic acid, DHA, and then calcium during labor are the things that I really focus on.
Okay, our next question comes from Sandra. Can you discuss in detail the NGML at C-section time? I know that 5 NG can equal whelping within 48 hours, but I've also had to do a C-section at 4 NG and it resulted in live pups. So what do the numbers really equal at the end of a pregnancy? What number means no viable puppies are possible?
And there is no answer to that question. Typically, we consider anything less than 2 nanograms. That's what the NG stands for, nanograms per mil. Anything less than 2 is probably safe to do a C-section. That being said, I had a dog that was at our practice on this weekend, and her progesterone was 0.46, and she was not due until the 19th of October or of November. So she was about 11 days from her due date when we saw her. She was in the process of, unfortunately, losing the litter. So even with appropriate antibiotic and supplementation, it was too late to save those puppies. So you can't use a hardcore number. 2 generally means it's safe. 2 or below generally means it's safe. I have done C-sections when the progesterone is over 10. And as long as we have good timing on the front end and we know when the ovulation happened, we're okay with that. We're good with being able to say that she's due in 48 hours, so her progesterone is at 10. And if you have a bulldog and you're at the clinic and you want to make sure she doesn't go into labor overnight, and you end up at the emergency clinic and you have great timing on the front end, you know what day she ovulated, you're probably okay at 10, but you got to have really great timing on the front end. If you don't have great timing, then you've got to do what we refer to as reverse progesterones. Now, I've seen bitches that don't have timing sit at 3 for 10 days. So if we'd taken them at 3, we would have lost the entire litter because they would have been born 10 days too early. You only get a 48-hour window, 2 days either side of the whelping date to have a successful litter outcome. If it's more than 2 days early, the puppies are premature, they can't breathe, they die. If it's more than 2 days late, the placental attachments start to fail, and you lose puppies because they're in the uterus without any oxygen, and they die inside the uterus. So you have a 2-day window either way. So I cannot overemphasize the importance of doing good progesterone timing at the time of the breeding and not waiting until the end to do your quote unquote reverse progesterones. Those make me crazy. They make most veterinarians that have to do them crazy. So I think it's really important that you do good timing at the beginning, know your numbers, know when she's due, write it on the calendar. Don't count on the breeding date, because according to breeding dates, you can have a pregnancy last between 58 and 70 days. That's a 12-day range. That won't get you live puppies. You have to have good timing on the front end. And then it's great if you have a veterinarian that can do a progesterone in-house and get you results within an hour. But many veterinary clinics don't have that. They have to send the lab samples out, which means that you're not going to get results fast enough to make a decision on your progesterone to cut at a C-section. So please, please, please time your girls, please.
Okay, great advice there. Now, our next question comes from Linda. Any tips to improve success in breeding bitches? I know you've kind of touched on this a little bit here already today, but more specifically, she's wondering with chilled breedings. Any advice there?
Sure. So really, it's important that you have good quality semen and good timing. If you're not timing it well, if you're guessing, I just had a client this week that said, well, I know she usually got pregnant on day 14, so I'm not going to progesterone test her. I'm just going to ship semen. I'm like, okay, I hope it works for you, but you really need to know what day she ovulates. So we breed 2 days after ovulation meaning 5 on most people's machines. So if we know what day she ovulates, we put fresh chilled semen in 2 days later. If you're struggling with not getting good insemination outcomes, then you want to make sure that the semen quality is good so that there's no question that the semen is getting there in good shape and that the sperm count is good. It's important to get a sperm count on dogs, and a lot of veterinarians can do this, but not all of them. I've seen sperm counts come in where I've gotten a note on the paperwork that says, better collection than last time, 2 squirts instead of 1. I'm like, that's not a sperm count, folks. I need to know how many sperm, how many billion sperm were in the ejaculate. So I know I'm putting in at least an insemination dose. So semen quality, semen count, good timing, and then of course the bitch has to have good nutrition, and then you need to have a good semen delivery system. So you can sometimes do fresh chilled with a pipette and just put it in vaginally, and it may work out well for you. But there may be other times that the semen quality isn't good or the bitch's fertility isn't good, and you need to go directly into an intrauterine insemination, which can mean either a surgical insemination or a transcervical insemination. That's when the endoscope is used. So if you don't have good semen quality, good semen delivery, you're going to have trouble. Now, I see people handling their semen with latex. So latex gloves, latex artificial vaginas, and latex, those black rubber stoppers in the syringes that we handle semen with. Those can all damage sperm and cause it to die. So you need to make sure that you're using latex-free products and make sure you're not using a spermicidal lubricant as well, because there are some lubricants, even if they're labeled that they're not spermicidal, I've seen them be spermicidal. So check all your equipment, look under the microscope if you have one to see what the semen looks like after you've put it in the pipette, after it's been in the syringe, after you've handled it, just to make sure that you still have swimmers, because if you've killed the semen, you're not going to get a pregnancy. Just saying.
That is very true. Okay, our next question comes from Michelle. She is wondering what to do do the worming after day 50 and through the second week of life. What do you recommend for worming now with the puppies? She's been doing 2 and 4 weeks with Pyrantel and then 6 and 8 with Panicure.
So typically, if you've had the bitch on Panicure during the pregnancy, the last 3 weeks of pregnancy through the first 2 weeks of lactation, generally you don't need to do any additional deworming unless you have either Giardia or Coccidia. So it's not a bad idea to do the Nemex at 2, 4, 6, and 8 weeks, but typically you don't need it. I would be spending a little bit of money on fecal analysis on some litters and see what you're getting for results, because you may actually not need to do anything else if your semen, or if your if your deworming is working well. So fecal analysis is really important. There are a couple of labs that run the fecal analysis that includes not just flotation, which your veterinary clinic can do looking under the microscope for worm eggs, but they also do the ELISA testing for the parasite protein. So it'll pick up Giardia much more effectively than a flotation will, and it'll pick up roundworms and hookworms very effectively as well. So you may be actually doing more deworming than you need to. But of course, it's never a bad idea to spend the money on a fecal analysis. You want to send puppies out of your facility clean. You don't want them to go to their new home with their first trip to their veterinary clinic and a stool sample that the client takes in to the veterinarian with parasites in it, because that doesn't reflect well on you as a breeder. And it just gives veterinarians another reason for them to say, well, you know, those breeders, yeah. We don't want that happening. We want you to send puppies out of your place clean. The other thing that I like to do is during the transition, the last 3 days at your house through the first 3 days at the new home, is I send those puppies home on Albon. Albon is, of course, going to help with coccidia. It does reduce bacteria in the GI tract. The main reason we're doing it is to stabilize the bacteria in the gut. The point being that when you do that, you actually have a lower risk of the puppies contracting parvo during the stress of adjusting to their new home, their new food, their new water, all those changes that take place. So those would be the things that I would use as resources.
Our next question, what do you recommend for a preventative that you can give a bitch while pregnant for coccidia, while pregnant and through raising the puppies?
So coccidia is kind of tricky. I use Albon. That's the only product that I will use for coccidia. However, if you give it around day 45 of the pregnancy, you will create midline defects in the puppies. It interferes with the metabolism of folic acid, the B vitamin, folic acid, B9. And when you do that, then midline defects like cleft palates and open abdominal walls and spina bifida can all occur. So you don't want to use it during pregnancy, or if you do during pregnancy, it's just got to be the last couple of days, like very, very, very close to the time that she's going to have the puppies. There are lots of protocols floating around on the internet about other drugs that people are using, and I'm not really sure why people are so enchanted with using drugs that are not FDA approved in the dog. It doesn't make a lot of sense to me that we're using a drug off-label, so far off-label that it's never been approved in that species in the United States for that use. So I'm not going to mention any specific drugs, but I think if you look online and you don't recognize this as an FDA drug, if it's not Albon or trimethoprim sulfa, which is a drug that's similar to Albon, I just don't think that it's safe. I don't think that there's any value in it. And I think it's just a bad idea. I've had people do things like Corid, where they mixed it in with the pregnant dog's food. Just a bad idea. It's not labeled for dogs, much less pregnant dogs. So you've got to be super careful what you're putting into your pregnant dogs. The only thing that should go into a pregnant dog is if it's going to make her and her puppies healthier. So I'm just not a fan of using anything for coccidia during that time period. If you do need to stabilize your gut flora, you can use a probiotic. Those are safe. And what I think is kind of interesting is that coccidia doesn't usually cause much disease in adult dogs. It's primarily a disorder that we see causing puppies to have diarrhea, not generally adult dogs. So if you keep her healthy, you keep her on a good nutritional plane with a good quality diet, and you have her on a probiotic, I think you're going to have very little need to do anything for coccidia during the pregnancy.
Okay, our next question comes from Sarah. She is wondering, what are your recommendations, again, with pregnant dogs when it comes to like flea and tick treatment? What is safe for them? Because I know not everything is safe for a breeding dog.
Right. And Revival actually has a great feature on their website. That's the flea and tick finder. I'm sure they'll be able to put a link up to that. And it goes through all the different products. We have a chart that the people that answer the phones at Revival can help you with if you have a specific question about a product. So anything that you want to look up, you can find online. You just look up for the PDF of the drug package insert. So you can Google it and you can find it. And those are, the drug package inserts are those gigantic printouts that are like a map. Once you unfold it, you'll never get it folded the same way again. But you can print those off. You can find them on your computer. You don't have to be a veterinarian to find them. That being said, for flea and tick prevention, there's some topicals that are safe and some topicals that are not. Frontline is safe, so the fipronil products are safe. The Vectra product, which contains contains 3 active ingredients, which is why it's called Vectra 3D. It is not safe during pregnancy. The Seresto collar is not checked for safety in pregnancy in the United States. It is in Europe, but not in the US. So you really have to look at the topicals very carefully because they will translocate. The way that the topicals work is that they are applied to the back of the neck and then they translocate across the dog's skin by getting down into the oil glands of the skin down in the hair follicles, and then it moves across the body. And so as soon as it moves across the body of the female, it's going to move across the body onto the puppies as well as soon as they're born. So you want to be really careful that what you're using is labeled for pregnant and nursing dogs. So read the label, and then if I didn't say it enough, read the label. Because you all have access to that. You cannot just count on your veterinarian to read every label for you and know this stuff. So number 1, check your topicals. Some of them are safe, some of them are not. So be really careful with your topicals. For the orals, there are 4 oral flea and tick preventives. That's Bravecto, Credelio, NexGard, and Simparica. Of those, only Bravecto has been tested and found to be safe during pregnancy and lactation. So again, Bravecto is safe. Credelio, NexGard, and Simparica are not tested. I can't tell you if they're safe or not. I have clients that tell me that they've been using them, but that doesn't make me comfortable. I want to be using a product that the company has spent the money on, proven it to be safe, and that they are committed enough to a breeder that they're going to do those tests and make sure that what you're putting on your pregnant dog or in your pregnant dog is safe. So I'm pretty much heavy-handed when it comes to this. I'm not going off the rails. I'm not going to be picking a product. I don't want your litter of puppies to be the footnote in the paper that says, oh, and by the way, this product causes this and this and this. For heartworm preventive, almost all of heartworm preventives are tested and found to be safe. So that's going to be any of the ivermectin containing products like Iverheart Max and HeartGuard. It'll include ProHeart, which is the moxidectin injectable that lasts 12 months. It will include the Sentinel products, which is the milbemycin. It does not include Trifexis. So heartworm is a lot easier to manage in a pregnant dog, heartworm prevention, than flea and tick prevention. So anything other than Trifexis for heartworm, and the only oral for pregnancy is Bravecto, and then the topicals being the Fipronil products. Many of these products are not safe, and just because it's a natural product, so if you're using one of the essential oils or the other types of products, natural doesn't mean safe. Natural means natural. So it may have come from a plant, but there are toxic plants out there. We all know that. So again, don't just reach for something that says natural and assume that it's safe, because some of those products are not.
The next question, somebody just wondering if you could talk a little bit more about DHA, and is there a certain one product that you would recommend to use for that supplement?
No, there's many DHA products. We have several in the catalog, so we can direct them to the ones that we carry. It is a fatty acid, so it is frequently found in some of the things like salmon oil and so forth. So it's not difficult to find. I take one every morning because it's supposed to reduce the risk of dementia. So I feed my little brain DHA too. So if you think you're going to have a hard time remembering DHA, so this is the time to write it down before your dementia gets too bad. DHA, get it for your dog, for your pregnant dogs, get it for yourself, and get yourself on it so that you're all as smart and have the best retinal function that you can have. So go for it.
Haley's wondering what sort of raw, like, what are your thoughts, I guess, on raw diets? You know, if a dog has been fed a raw diet since, you know, puppyhood, should you continue that? I guess, what are your thoughts there?
I never feed raw meat diets. I don't really think that they're safe. I don't think that they're nutritionally complete. I think the parasites and the bacteria are a problem. I am just not a fan, so I avoid them at all costs. I think it's a really bad idea. So I don't feed raw meat diets. I don't recommend that people do. We see a lot more C-sections in our bitches that are on raw meat diets. Their calcium phosphorus balance is off. So if you look at WhelpWise, which is the whelping contraction monitoring service online, you can see their studies on calcium. We don't think that they're nutritionally complete for pregnancy or for lactation. Dogs need carbohydrates to lactate. They need carbohydrates to grow puppies, and a lot of the raw meat diets are carbohydrate deficient. A lot of them are nutritionally deficient, but the other concern isn't just nutritional deficiencies, it's also nutritional excesses. So if you feed too much liver, that's going to have too much vitamin A in it, and you're going to get back to that midline defect we talked about a few minutes ago. That's where the cleft palate, the open abdominal wall, and the spina bifida lesions can occur. So you have to worry about nutritional deficiencies, nutritional excesses, and you have to worry about parasites and bacteria. There are multiple reports of puppies that are born and die after birth due to diseases caused by raw meat diets like Neosporum and Toxoplasmosis parasites. There's Salmonella, Shigella, Campylobacter, a lot of bacteria that are in the raw meat products. And you're also exposing your family to that by the dog having it in their mouth and coming over and kissing the kids and those kinds of things. So I just avoid raw meat diets. I don't think they're appropriate for a dog that's pregnant and nursing. If you want to feed it before it and after it, I can't change what you do, but I would definitely not recommend it during pregnancy and lactation for the reasons listed.
Okay. Our next question is from Elaine. She is wondering, she has a question about male fertility. Her 2-year-old male cavalier has not had good quality semen and low motility for a while. Her repro vet has had her start him on CF plus, and she just started OxyStud. Is it okay to use both products on him? Also, I'm a stud powder from Nature's Pharmacy. he just bred 2 of my girls naturally, very easy to collect, and she has not been able to get a semen analysis yet.
Sure. So I don't know anything about the stud powder from Nature's Pharmacy. I would have to read the label and see what's in that. I am unfamiliar with that product, so I can't really make any comments about it. The CF Plus and the Oxy Stud, yes, they can both be given at the same time. 2-year-old dogs usually should have good semen quality. So again, I'd switch back and talk about nutritionally what you're feeding. And then it's great that he has good libido, easy to collect. It's great that you can get natural breedings, but without a semen analysis, it's difficult to know what you're going to have. Now, a small dog like a cavalier is only going to have about 200 million sperm in a collection. That's absolutely normal for a small breed dog. We normally can multiply their weight by 10 and get a pretty good idea of what their sperm count should be. So a 60-pound golden retriever should have 600 million sperm. Cavalier may have 200 million, and that should be enough to get a bitch pregnant, assuming that the semen is good quality. So the other question then, when you talk about not good quality semen, is does that mean bent tails? Does that mean abnormalities in the acrosome? Does that mean that they have detached heads and detached tails? It's a little vague on this. So the other thing to remember is it takes 62 days to grow a sperm from start to ejaculation. So it can take close to 3 months before the nutritional supplements and the diet and the other things that you're doing environmentally will make an impact on his semen quality. So it's going to be difficult to say without a semen analysis more than 60 days after the original collection what his semen quality is. I'm happy to look into the stud dog product, but I can't make any comments about it because I just don't know enough about it.
Okay, we've got some more great questions coming in here. Linda is wondering, can you give more information about using anti-inflammatories during breeding to improve fertility?
Sure. And this was introduced to me by Emmanuel Fontaine, who is one of the Royal Canin veterinarians in Canada. He did his training in Paris. And he shared a study that was done, actually 2 studies that were done, that showed that 50% of bitches that had previously been infertile and had no puppies, with the use of anti-inflammatories, had litters of puppies. So the anti-inflammatories that are used are going to be veterinary products, which would be things like Metacam, which is meloxicam, and Rimadyl, which is carprofen. So it's used on days 2, 3, and 4 after ovulation, and again on days 15, 16, and 17 days after ovulation. And I think what makes sense is during the 2, 3, and 4 day after ovulation time period, it makes sense that that will improve fertility because that's when fertilization takes place in the oviducts. So if the oviducts are swollen or scarred or anything like that, and the sperm and the egg can't get together, you're not going to have puppies. And then on days 15, 16, and 17, that's when the placenta forms and attaches to the uterine wall. So without a happy, healthy uterus, we're not going to have that. So the anti-inflammatory at that point makes sense that we've quieted down the uterus and make it a more hospitable place for the placenta to form and the puppy to continue developing. So it's days 2, 3, and 4, and days 15, 16, and 17 post-ovulation, ovulation being in my lab 5 nanograms per milliliter. So I hope that helps. We've had some good success with that protocol in our practice, and it is safe to use on those females during that time period.
Our next question comes from Kathy. She's wondering, when is the soonest chance of seeing sperm after none has been found?
Yeah, and again, that is highly variable. If it's a young dog, if he's 7 months old and you've collected him and he's been happy to ejaculate, but there weren't any sperm in it, I think that he may just be too young to be mature. And so some dogs aren't mature until they're 12 months old. Some of the large breed dogs, the really big ones, the St. Bernards, the Mastiffs, they may not have sperm until they're 15 to 18 months old, just because they needed more time to mature. If you're talking about after some kind of treatment, like there was an insult, he had a fever, he was sick, he wasn't on appropriate nutrition, any of those things that can affect semen quality, it's going to take at least 60 days. So you can certainly collect him during that time period, but I would not collect him every day. I would give him plenty of time to just rest and recover. So I would probably check him about every 30 days and see if what you're doing, if you've got him on antibiotics, if you've got him on a nutritional supplement, if you've got him on any of those things, to see if quality is improving. I would only use an antibiotic for a male dog with fertility issues if it had been something prescribed by the veterinarian that had done the semen analysis.
Okay, our next question. Can we talk about puppy diarrhea? Who doesn't love talking about puppy diarrhea, right? I know that's one of your favorite topics.
Exactly.
Within the first 2 weeks of life, what can we do for them? It always seems to come around day 5 to 7. Sometimes it's green and seedy. Sometimes it's yellow and seedy. She's taken samples in and nothing ever comes back. And Dr. Greer is dressed for this question. You have even the attire.
Yes, my favorite hat, my poop hat. So yeah, good question, because lots and lots of puppies have diarrhea during that time period. It is not unusual. It is not surprising. So green and seedy is not normal. Yellow and seedy is. That's absolutely normal for it to be yellow and seedy. So if you're taking stool samples in, first of all, you want them to do more than just a flotation, because a flotation is only going to tell us if the eggs are present. And in puppies under 2 weeks of age, they can have a parasite that isn't mature enough yet to be producing eggs. So you can absolutely miss a positive sample because the parasites in the puppy's gut are not old enough to make eggs. So that's when you want to do the test that does the ELISA test or the PCR to assess further what you're going to have for parasites. So that's the first thing to do, is don't just get a flotation, get a PCR test. Secondly, if you're seeing abnormalities and they're not finding any parasites, you can do a stool culture. That requires a special test that they send out of the veterinary clinic. It can take up to 5 days to grow the bacteria that may be present. So for sure, you want to give them a chance to do a stool culture. As far as managing it, I use yogurt and baby rice cereal mixed together that you can feed to the puppies to help slow down the diarrhea. That baby rice cereal that comes in those boxes, that flake of baby rice cereal, you can mix that with yogurt and help syringe that into the puppies. You can use probiotics. We've got a really nice probiotic. Doc Roy's GI Symbiotics is a really nice one that comes in a paste. Easy to put on the tongue of a puppy, easy to get them to swallow. So you can easily get a probiotic into them. I would not reach for an antibiotic until I knew if I had the need for it, but I use a lot of kaopectate. Now, human kaopectate is the same thing as Pepto-Bismol. It metabolizes into aspirin in the GI tract. Do not use human kaopectate or Pepto-Bismol in young puppies. I don't use it in pregnant dogs. I don't use it in young puppies. It's an aspirin product and that's not safe for them. But kaopectate, the veterinary one that we carry at Revival, and we also see at other locations, it comes in a great big gallon. A gallon will last you the rest of your life. It's basically clay and it's an absorbent, so it will help to absorb some of the toxins. It will help slow down the GI tract so that it's got less fluidity to the stool. So you can very easily give a cc of that kaopectate, the human, or the veterinary, not the human one. You can give that to a young puppy. You can do it through a feeding tube, or you can syringe it slowly into their mouth so that they'll swallow it. And I have good success with that. But don't get too alarmed. I mean, the stool should be yellow and seedy. That is an absolutely normal color. If you see blood, that's signs of sepsis. If you see white stool, they're probably overeating. And frankly, a lot of puppies do have diarrhea because they overeat. At every one of my C-sections, I send home kaolin and pectin with my clients, the veterinary product, because I say to them, somebody's going to have diarrhea. It may be the bitch, it may be the puppies, it might be you, but at some point, everybody during this first 2 weeks of puppyhood is going to have diarrhea. My own litter of puppies, my bitch just had it. She's a little corgi that weighs 24 pounds. She's eating 6 cups of dog food a day to keep up with her puppy's nutritional needs. So yes, she has diarrhea because there's just so much going through her gut. So we've had her on a probiotic and that straightened her right out. I didn't have to do anything else, but those would be the things I would reach for. Do not reach for antibiotics. Don't reach for antidiarrheals. Things like Imodium, not at all safe in a young puppy, not at all. So stick to your kaolin and pectin and your baby rice cereal and your probiotics.
Okay. We have somebody kind of asking a question as far as, maybe talking to their vet or finding a reproductive vet and getting some of these prescription products that you've mentioned for as far as reproduction or reproductive products for prescriptions, I guess. What do you have any tips or advice when it comes to getting these prescription products from a vet for reproduction?
And some of the products we carry are not prescriptions. Some of them are over the counter, so it's not difficult to get those. We're happy to help you. I'm happy to do a consult with you and help you pick out what products are going to be the most successful for your particular situation, because not everybody has the same thing going on. If you are looking for a veterinarian that does a lot of canine reproduction, there is a website, Therio, T-H-E-R-I-O, therio.org. That is the association that veterinarians that do a lot of reproduction join. Now, they may do all species, they may do horses and cattle. And I have a colleague in the Therio organization that does reindeer breeding. Believe it or not, he is the reindeer semen guy. So he collects reindeer and he inseminates reindeer. He makes the baby reindeers that Santa uses. So it's very important that he does this job. So Therio.org has a find a vet feature on it. So if you go to that and you put in the species like canine or feline, you put in your zip code, you can find veterinarians in your area that are breeder friendly. There's also a, believe it or not, breeder friendly Facebook group. So if you're struggling to find a veterinarian that understands you as a breeder, those are great resources to find somebody. Otherwise, you find a veterinarian that's willing to work with you, that is willing to help you outfit yourself with some products to have at home for emergency use. I think it's really important that you do have a well-stocked but small and appropriate pharmacy, so that if something happens in the middle of the night or on a weekend when you can't get a hold of your veterinarian, you are equipped. And most veterinarians will help you with reasonable amounts of medication. They may not want to send you a 500 count bottle of an antibiotic, but they may send you 14 of them to get you through a few days that you might need help with. So work with a veterinarian, get a good relationship. And here's my other plug. Veterinary staff right now is immensely overworked in almost every clinic. So if you have a favorite receptionist, a favorite technician, a favorite doctor, take them a plate of cookies, take them a bottle of wine, take them something that will help, so that when you call the next time with a crisis, they are more willing to pick up the phone, get you in on an appointment basis, on an emergency, help you out with those things. If you're grouchy and horrible to your veterinary team, they're not going to help you. You need to be nice to these people, because they are most days skipping lunch, staying late, coming early. They're working really hard right now to keep up with all the pet supply demand that we have. So be really nice to your veterinarian, and you would be surprised how much better things go.
Advice there. Next question. How much weight should a puppy gain daily on average?
So the formula for this is 1 to 2 grams per day per pound of anticipated adult body weight. I know that's a mouthful. I practice this regularly, so I can say it. So it's 1 to 2 grams. So 1 gram to 2 grams per pound of anticipated adult body weight. So if you have a dog that's going to weigh 60 pounds, that puppy should gain 1 to 2 grams. So 60 to 120 grams per day. So you can figure this out pretty effectively. Basically, puppies should double their birth weight in 7 to 10 days. They should always be gaining. If they lose more than 4% of their body weight during the first few days of life, they have a lowered survival rate. We used to say they could lose up to 10%, but now from the NeoCare workout of France, we know they shouldn't lose more than 4% if they lose any at all. So keeping them well nourished is very important. So they should double birth weight in 7 to 10 days. And typically, like a golden retriever puppy is going to gain 1 to 2 pounds a week. That kind of helps you out to figure that out.
Okay, our next question is a follow-up question from Elaine earlier. She was the one with the 2-year-old male cavalier with the not good quality semen. And her question, kind of adding to it from before, he also had bent tails and no heads on some of the sperm. I had an appointment to test his semen again. However, he decided to breed my girl on his own that morning, so nothing available. I have another appointment next week. I feed blackwood kibble with wet food and pumpkin, and canine cravings raw in the evening with yogurt or kefir. What should I feed him? We use no chemicals outside. He weighs about 15 pounds.
Sure. So yeah, you're right. I don't approve of that. Sorry, but I would start with a nutritional change. I will tell you a short story here in a second. No chemicals outside. I'm not sure what that means. If that means you're using chemicals inside, I'm not sure. But you do want to be careful with those things. I think yogurt or kefir added to the food is okay. I think pumpkin added to the food is okay, but you don't want to exceed 10% of their diet with other nutritional things. You want to stay at 90% dog food, 90% or more dog food. So I had a client that came in 2 years ago. He called me before he came in and we had a consult on the phone. And he had a line of golden retrievers that his in-laws had started 50 years ago. This was a 50-year-old genetic line of dogs. And in the 50 years that they'd been breeding those dogs, they had had no fertility issues until the past 2 years. So he married this woman, that was her family's business, and they also raised mink. On the mink farm, they went to the feed mill and they had mink feed made for their mink farm. And this is pretty common back 50 years ago when mink farms were a big deal. There's still quite a few of them in Wisconsin. But that's where From Dog Food and a number of other pet food companies started off. It was a mink feed company that then expanded into dog food. So they were having their dog food made by the same feed mill that made their mink feed. And in the last 2 years, their bitches weren't cycling. If they were cycling, they weren't getting pregnant, but any outside females that came to their stud dogs were getting pregnant. So they knew their males were okay. They knew that wasn't their problem. They knew it was in the females. And so I said to him on the phone, so what do you feed? And he told me, I feed this really great diet. And that's when he told me about the mink food and the feed mill making his food. Well, I said to him, okay, I need you to do 2 things for me. One is you need to go buy a bag of Purina, open it and start feeding it today to the females that you need to have come into heat. And number 2, I need you to go back to the feed mill and find out if they made any changes in the nutrition that they were putting together for you. And it turns out that 2 years prior at the feed mill, somehow a decision was made to stop adding the mineral pack and the vitamin pack to the pet food that they were making to the dog food. And nobody can exactly explain to me if it was a financial decision or if there was a personnel change at the feed mill and they didn't understand that they were supposed to add that, but the food looked and smelled the same to the people. So they didn't recognize that there was a micronutrient deficiency happening in this food. So it still had the right amount of fat, protein, and carbohydrates. Like I said, the macronutrients, but the micronutrients, the vitamins and minerals were lacking. So by the time he came in to see me 2 weeks after his phone call, he'd started 2 of his bitches on Purina. The time he walked in my door, they were both in heat. Immediately, these girls came into heat. We bred them both. The older female, he progesterone tested. The younger female, he said, well, you know, I'm not going to spend the money on it. I'm just going to progesterone test the older one because I've absolutely got to get puppies out of her. She's 6, but the young one I still have some time with. So we progesterone tested the older female. He came back 4 weeks later. The older female that we progesterone tested was pregnant. The younger female was not. We progesterone tested her that day and her progesterone had never risen. So she had either a split cycle or an anovulatory cycle. She didn't really have a heat cycle. He has since been in with his other dogs and they are doing fabulously. He's back to producing litters. He is thrilled. And it was all about the nutrition. And I don't know how much more clearly that I can say the micronutrients are so important and it's so hard for you to chase it down, that you're just going to be better off to feed a diet that we know is successful for other people's dogs. And those are going to be the Royal Canin and Purina diets.
Next question. Any suggestions to get a corgi female to eat? She had a C-section on Friday, ended up with only 2 live puppies as they were huge and stuck. She does not want to eat. This person has tried Royal Canin starter, baby food, scrambled eggs, broiled chicken, rotisserie chicken, 3 different dog foods, yogurt, cottage cheese, foster care puppy milk replacer as a flavor additive, Fortical. Any other ideas? This person is out of ideas.
Yeah, and corgi bitches are usually pretty willing to eat. So my questions would be, is she running a fever? So have you taken her temperature rectally? Have you had her on pain medication after the C-section? Did your veterinarian send you home with Medicam, Tramadol, Rimadyl, anything to manage her pain? Because post-op pain after a C-section should be managed by, I've used Medicam for 20 years on my postpartum females, and we do about 150 to 200 C-sections a year in our practice. So enough of them to say that we're pretty comfortable with having done this over 20 years time. So I would also want to know if she's on any other medications. Sometimes if they're on Reglan to help bring in their milk, they'll have an upset stomach from that. So I would stop Reglan. I love feeding bratwurst. I know that sounds crazy, but it helps the bitches to lactate. Bratwurst, for those of you who are not from Wisconsin and Minnesota, bratwurst are sausages. They're a German style sausage. I don't know why dogs lactate on it, but yeah, they do. So she was on meloxicam, tramadol, and Clavamox, and no fever. Okay, that's good. She may still have a bit of an upset stomach because meloxicam can cause problems, especially if you're giving out an empty stomach. So I would add some Pepsid AC and some kaolin and pectin in, and see if you can help settle her stomach enough that she feels like eating. You can also try ice cream, but as far as that being really gentle and easy on the tummy. But I would talk to your veterinarian about Pepsid, or just go to the store. You can buy Pepsid AC 10 milligram tablets at the store without a prescription. Famotidine is the active ingredient. The generic is fine. And I would give her a Pepsid twice a day and see if you can get her stomach to feel enough better that she'll eat. It's unusual for a corgi to miss too many meals. My corgi bitch that I just did my C-section on, we did it at 6 o'clock in the evening. And by the time I got her home at 8:30, she was chowing already. So corgis are generally pretty good eaters. They're sort of like Labradors in little bodies. So I would definitely talk to your veterinarian if the Pepsid doesn't get things under control.
Next question. Somebody's wondering about that new heartworm preventative shot that lasts 6 to 12 months. Is it safe or the best option over monthly chewables? I guess, what is your thought on that?
Yeah, and I have a lot of colleagues that use it, especially the ones in the southern states where they have a lot more heartworm disease. We're in Wisconsin. We rarely see heartworm unless it's from a dog that's imported from the southern tier of states. So it is safe during pregnancy and lactation. It's been tested. We know it's safe. The advantage to it is that there's better compliance. You weren't going to forget to give the chewable on the first of the month. You're not going to have the dogs spit it out behind the couch, and you don't find it for 3 weeks until you pull out the couch and vacuum behind it. So absolutely, the injectable is fine and it's safe. There are some reports of dogs that get sick after the injection. You should only give it to dogs that are healthy. I have personally not used it because we just don't see enough demand for it in our practice that we would go through enough vials of it. It is a sustained release product, so what you put in the dog is going to be there for 12 months. So you don't want to use it on a dog that's not healthy, a dog that's not feeling well. But the reports are that it's safe and effective. And for my friends that have practices, veterinary practices in the southern states, where they'll see 100 cases or more in dogs that are on chewable heartworm preventives, they're finding it to give them better control of heartworm prevention. It depends on what state you live in. It depends on what kind of dogs you have. It depends on how hard it is to medicate them. And of course, then you have to look at the bottom line on cost, whether it's more cost effective to do that or the chewables. Personally, for my own dogs, I use the monthly chewables, but I have no objection to using it during pregnancy and lactation. It is labeled as safe.
Our next question is from Maggie. She's actually kind of wondering, what are your recommendations as far as spaying and neutering puppies? Like, what age for young puppies do you recommend spaying and neutering?
I like to wait until they are skeletally mature, meaning that they are mature enough that they're not going to grow anymore. That's going to be after a heat cycle. That's going to be after puberty. That's going to be in small breed dogs, 10 to 12 months of age, and large breed dogs, 15 to 18 months of age. That is the earliest I like to see spaying and neutering done. That is not the mainstream. That is not what a lot of veterinarians like to do, because they like to spay them when they're young and skinny and easier to spay because it's a simpler procedure for the veterinarian. But I think from a perspective of reducing the risk of cancer and reducing the risk of other diseases, we are better off to wait until they're older. In the pandemic puppy book that I wrote, it goes through all this information, so you can check it out there. And we also have a webpage on our website called the Spay Neuter Controversy at smallanimalclinic.com. You can take a look at that, and it's got links to a lot of articles that reflect that important piece of research that shows how much safer it is to wait until the dogs are older. So we see less obesity in females, less urinary incontinence, less puppy vaginitis leading to urinary tract infections if they've had a heat cycle before they're spayed, less cruciate ruptures. It's 4 times more common to have a cruciate rupture in a golden retriever that's spayed at a young age than it is in a dog that's not spayed, 4 times. And cruciate surgeries are between $3,000 and $5,000 a knee. So that's a $10,000 decision that you're making when you spay or young. Less hip dysplasia, less allergies, less thyroid disease, and less bone cancer, which is osteosarcoma, less spleen cancer, which is hemangiosarcoma, and less lymph node cancer, which is lymph node cancer, lymphosarcoma. So all across the board, you can see that there are a lot of medical advantages to waiting. The reason I think a lot of breeders like to see their dogs spayed and neutered young is because they don't want people going out and breeding dogs that were not sold as breeding dogs. but you have to weigh the benefits and the risks. And if you're selling dogs to people that you don't trust, then you probably should be selling them to different people. So I would be looking real hard at that research. And there's, like I said, a lot of this information is on our website, so you don't have to buy anything for that. That's the Spay Neuter Controversy on our website, or the Pandemic Puppy book if you want to read some more about it there. AKC website has some good webinars with Benjamin Hart. He's done a lot of the research on this. It's really important that we get a good handle on this and stop spaying and neutering babies.
We just got another question coming in from Linda. That's right at the last minute here. How long do you recommend feeding puppy food and the age?
Puppy food, I feed again until the dogs are at a mature size. So it depends on the breed. If it's a toy breed, they're going to mature around 6 to 8 months of age. If it's a large breed dog, it's going to be closer to 15 to 18. So it depends on the breed. It depends on the puppy's weight. If you have a fat little Labrador puppy, you may need to switch to an adult food earlier. If they're having bone joint problems because of growth, that kind of stuff, you may need to change sooner. But generally puppy food can be fed up until they're somewhere between 10 and 15 months of age, 18 months of age, depending on the breed. And one more question.
Last question. Yes. Yes. I just saw that pop in from Robin. Do you recommend spaying females after they are retired from breeding?
I do. We see about 25% of females that are retired, whether they're breeding dogs or not breeding dogs, with pyometras. Pyometra is a serious life-threatening uterine infection. It's very serious. It's very expensive. I just spayed one last night at 7 o'clock. The rule in veterinary medicine is never let the sun set on a pyometra because it is that serious a disease. So yes, once she's done, retired, you're not using her anymore for breeding, spay her, let her live the rest of her life at your home or in a pet home, and just let her relax and not have to worry about that infection in the uterus, pyometra. It's a dreaded disease. It's right up there with bloats and hit by cars as far as the things veterinarians and their clients dread to see.
Thank you again for joining us today. And again, check us out at revivalanimal.com or call our pet care pros 800-786-4751. Thank you so much, Dr. Greer. Oh, as always, you're so full of knowledge. We love it. Thank you.
Thank you.
Hi, if you're watching on YouTube, consider subscribing to the Revival Animal Health YouTube channel. If you have a pet health question, call our pet care pros at this number. And don't miss our other pet health videos.